The COVID-19 storm has made landfall in Gauteng. Hospitalizations are at an all-time high. The health minister rallied the proverbial troops at the Nasrec Field Hospital.
I think in the country, Gauteng is still at the top of the rate of infection. KZN is taking over now, and therefore we're going to be discussing with them how to move ahead so that they don't get caught up with the numbers. It should be possible to make sure that whoever the patients that they have to admit, they don't have a challenge with beds, with oxygen. The plan is what we think must happen. The intervention is what you do to respond to the changing situation as the pandemic is showing its different pressures. So you can never know for a fact what's going to happen, but you must be ready to respond as soon as things go wrong. And that's why now what we do, we just call anybody to find out, hey, what do you see there, what's happening, just so that we get a sense, because there's no formula, there's no textbook for this thing. There are some certain basics are in place, but the day-to-day action is what really makes a difference. And so whenever you, as clinicians, feel the pressure, you need to make sure everybody feels it, so that we must respond.
Many have heeded the call at field hospitals such as these across the country, from infectious diseases specialists and student nurses to newly qualified doctors and seasoned health practitioners who have worked on Ebola infections on the continent.
Although the SABC did not get exclusive footage of inside the hospital, obviously where the patients are being bedded and quarantined, we got a glimpse of the frontline workers with regards to looking after the patients and those who are infected with COVID-19. And this is the story of the people who come in and day out, most of them volunteer nurses and volunteer doctors, volunteer healthcare practitioners who've braved the contraction of COVID-19 themselves to come out and help their fellow South Africans. Most of you are volunteering your services at a cost of maybe even contracting COVID-19 yourselves, but it's that oath of being a doctor or medical practitioner that you undertook that has driven some of you here, and some of you're just doing it for your fellow man. Exactly.
Well, I feel like it's all because of the love. When you sign an oath, when you start with your practice, or when you're starting your degree initially, you need to sign an oath that people's lives first before your life. So I feel like that's what we are doing right now. This convert actually brought about the real health practitioners. Are you doing this for money or because of love? I think that's the main reason.
The patients there inside, okay, they are not that aggressive. They are compliant to what we are telling them. So they are also working with us because in their minds they just want to get better. They want to get better. So they are working hand in hand with the practitioners.
Nasrec is currently housing 21 patients on intermediate care who need oxygen, as well as 147 others who require minimum care. Most are here to isolate, as they cannot do so at home.
We spoke to one or two of the guys and they said, it's been fun. They are being well taken care of. And there's always the propensity for people who are at home saying, do I need to go to a government facility, maybe I should go private. People here are being taken care of.
I've very much been taken care of. The food is nice, it's warm. The food's nice, it's warm. People are out in the sun in what would otherwise be a recreation area. And they're keeping their families safe by being here. So, if people have got COVID and they live in a crowded area, which many South Africans do, we know, and they're worried about transmitting it to their family, then there is space available at the Nasrec facility. And people will find food, they'll find Wi-Fi, they'll find Netflix, they'll find, friendly people. We may all be hidden behind a mask. I'm sorry about that. But I could think of worse places to spend a couple of weeks to protect my family.
The experience has been overwhelming, to be quite, because I didn't know how to take it, but now I can see which is right.
Yeah. I see you guys are having fun.
Yes, long sanitizer na manje. Yes.
Yeah.
Yeah, we're just chilling. I mean,
Yeah.
I mean, there's nothing to fear.
COVID-19 is very, very dangerous. Some they make it, some they don't make it, and there's not a good experience to be infected by this disease.
Well, thank you very much. As you can hear, those are just some of the volunteers who we've seen throughout as we've been left into the Nasrec Field Hospital. Some of them saying, as you heard from these two young ladies, they're doing it just for the love of giving back to the community. Some are saying, look, I was studying, I did not get a job, and this is my opportunity to get some experience, and in the future they can be in well standing that they hold and they gained that experience through this tough pandemic. For SABC News, I'm Tommy Sositol and cameraman Toby Madilula in Johannesburg.